Hello everyone, this is Dr. Shishma Sarala, consultant homeopath at Fidicus Homeopathy. Today we are going to discuss about a very important and also very common topic called as warts. So why are we discussing about warts today? The reason is that many people don't know that warts are a viral infection, primary thing. Secondary, that they are very contagious, and also because of the pain, especially warts which are present on the backside of the foot, that is the sole of the foot, because of the pressure during walking are very painful, and also the warts are appearing on the face or any visible part which are exposed. They make the person feel very aesthetically unpleasing, so it is emotionally disturbing as well. So let's dive into the topic to know more about warts. So what are warts? Warts are benign non-cancerous growths that appear on the skin as well as on the mucosa. What do you mean by mucosa? By mucosa, we mean that inside of your buccal cavity can also contain warts. Who is the culprit? Human papilloma virus is a type of virus which causes warts. Different strains of human papilloma virus causes different kinds of warts. So what are the signs and symptoms of warts? Remember, signs and symptoms of warts can be divided into two parts. First is the common signs and symptoms. Second is alarming signs and symptoms. So what are the common signs and symptoms of warts? First thing, small, fleshy, grainy bumps on fingers or on hands. If you can see this picture, you can see these small bumpy nature where you can, if you feel it, it is very thick in nature and also grainy when you touch it. And if you look closely, you will see small black dots. Those are dead blood capillaries or dead blood vessels. You can say capillaries because only a thin part or the smaller capillaries get stuck in near the warts and they become dead. Small flesh grainy bumps, feeling rough to touch, and sprinkling of black dots because of clotted blood vessels. So what are the alarming signs? So these are the common signs. When should you be worried about these warts? Primary thing, if the warts hurt, bleed or burn or itch, that means if you're having a wart on your hand or on your face or on your neck or on the genital region or inside of your buccal cavity, when they start to bleed, when you touch them or when you feel them, they start to bleed. They start to itch very severely and they start to burn. They have a burning sensation in and around the wart. That is an alarming sign. Next, persistent warts with spread. That means when you start developing one wart, they severely and rapidly spread through that area. And not only that, if that one wart which is in one hand is starting to appear, or different kinds of warts are starting to appear on the other hand, the spreadability or how far it is spreading and how fast it is spreading is also an alarming factor. And growth are bothersome or interfere with activities. For example, if you are having warts on the soles of your palms, and whenever you're touching something, doing something, they are very painful, they're starting to bleed, they're starting to itch, then that is a bothersome sign. If you're having many warts and you're unsure whether the growths are warts, that is, if you're having certain growths on your hands, your face or your body, anywhere on your body, and they seem like warts but you're not sure if they are warts or not, they can be cancerous growths as well. So to determine if it is a wart or a non-wart, you have to consult a doctor. If you have weak immune system, especially people who are under immunosuppressants or people who are suffering from HIV, that is AIDS, can also be prone to warts. Now let's get into the investigation part of warts. Examination. Whenever you consult a doctor, the primary thing a doctor will do is examine the wart. By what do you mean by examination? We will see if the wart is having certain boundaries, if there are any clotted blood vessels inside the wart, the structure of the wart, how it is it a flat wart, the morphology of the wart, that is how it is appearing as such, and its spreadability also. And what is scraping? After examination, the healthcare provider or your doctor can scrape the upper part of the thickened wart to see the inert picture of the wart. And skin biopsy. If needed, we can do a skin biopsy to see what kind of wart it internally is. Other tests. As we've already discussed, that human papilloma virus can cause warts, and also that different strains of human papilloma virus or different strains of HPV will cause different strains of or different types of warts. So, immunohistochemical detection and also southern blot hybridization and PCR, which is polymerase chain reaction, can identify what kind of strain of HPV it is and what kind of wart it is and how is its spreadability. Now let's get into the structure and function of the skin to know more about warts. As you can see here, the skin is made up of three main layers. The first one is the epidermis layer, the second is the dermis layer, and the third is the hypodermis or the subcutaneous layer. The epidermis layer is helpful in protecting our skin from outer environment. So it acts as a barrier. And the second is the dermis layer, which contains blood vessels, and also it contains the sebaceous glands, it contains the hair follicles. The dermis layer, from the dermis layer, the blood vessels where it is supplying blood, the nutrition goes upside, providing nutrition even to the epidermis layer. And then we have the hypodermis layer, which is useful for insulation. So if there is any break in this epidermis layer, or if the epidermis layer is becoming thin, like when we start to age, the epidermis layer will start to thin out. Or if you are using a lot of chemical exfoliants, this epidermis layer will start to thin out. The thinning of the epidermis layer, or a crack in the epidermis layer, or weak immune system can cause or lead to HPV warts or warts as such. Now let's get into the causes and risk factors for warts. As we have already discussed that human papilloma virus is the main culprit or the main cause for warts, first let us know about the risk factors. Primary risk factor being damaged skin. Any break in the epidermis layer will allow this virus to go inside of the skin, causing warts. Second is sexual behavior. If you are having multiple partners, then you are more prone for HPV virus. And from one person, the HPV virus can spread into the other person. Weak immune system. If you are not having proper immune system, so usually even if you have a break in the skin or even if you have a HPV infection, the immunity will help in fighting that HPV. But you have a weak immune system, if you are suffering from autoimmune diseases, or if you are suffering from HIV, or if you are taking immunosuppressants for a drastic allergic reaction or immunosuppressants for certain diseases, that can lead into sustained infection, or the immune system is not able to fight the HPV properly. Age. Aging can cause thinning of the skin and also weakening of the immune system, leading into HPV virus contact and also spreading. Personal contact. Remember that HPV can spread from one person to other person and also from one part of the body to the other part because of direct contact. If there is a wart here which is HPV infected, and if you are contacting it, that wart can spread, or that HPV virus can spread from one part to other part and also from one person to other person through direct contact or through towels that they are using or through the materials that they are using. Now let's get into the body changes of warts. That is, what happens inside the body for the virus to get inside and make it spread. First thing, as you can see here, this is the wart formation. Let us know in detail, step by step, how this wart is forming. Any cut in the epidermis layer or weak immune system or thinning of the epidermis layer due to age, any cut or frequency in cuts. For example, if you are walking barefoot on a beach, or if you are walking barefoot somewhere, or if you are using your hands a lot without cleaning them frequently, minor cuts can also cause this HPV to get inside. And when it gets inside, it starts affecting the basal cells which produce these keratinocytes. So what happens? How does it affect these basal cells? Remember that this virus needs cells for replication. That is, it will go inside the cell, it will alter the DNA process, and it will make this cell to produce HPV virus, the agents of HPV, or it will go inside the cells and it will replicate the DNA and it will help in producing HPV viruses. And when this cell is bursting out, it will release the HPV viruses or lot amount of HPV virus. This is how they reproduce. So when these HPV viruses are more inside the basal cell, they will affect the basal cell, and also they will cause one more reaction in the basal cell. That is, they will cause hyperproliferation. What is hyperproliferation? For example, if one basal cell is dividing into two under normal conditions. Under HPV influence, one basal cell will divide into 10. So increased basal cell production of keratinocytes, it will go up and it will be pushing and it will cause Wart formation. Virus inside the basal cell, increased production, epidermal thickening, coleocytosis. What is coleocytosis? The Wart formation or this tumor-like formation is called coleocytosis. This is how a wart develops inside the skin. Now let us know in detail what are the types of warts. First one are common warts. As you can see in the picture, these warts are usually small bumps which form especially on the hands or on the foot or on the face. These are less itchy and also very commonly found. These are a second type of warts called as flat warts. As we can see that flat warts means when you feel them, usually they are less bumpy. There is no similar texture or similar bump here. You can see overall very little thickness and they're very flat when we feel them. And they usually appear on the face or on the palms or on the hands. The next kind of wart are filiform warts. What are filiform warts? As you can see here, they grow a little bit more than the common wart. That is, their projection is little bit bigger than the common wart and also they have different growth patterns. See, usually if you see through naked eye, we can feel that the wart is like this, irregular growth. This is filiform appearance. That is, they have filaments growing from the wart. If you feel this is a skin, the wart will usually grow like this. It's not the same or the smooth. The common wart is smooth like this. The flat wart is like this. But the filiform wart has projections. The filiform warts are usually present on the palms of the hand and also sides of the hand and also face and especially on the neck. Next, coming to the mosaic warts. So what are mosaic warts? As you can see in the picture, usually on the plantar surfaces, that is on the palms or on the feet, soles of the foot, you can see these mosaic warts and also even on the hands and also the elbow region also. But the peculiarity of the mosaic wart is that usually there are 2 or 3 clusters of it. The filiform wart has projections, the common wart is soft and bumpy, the flat wart is very flat to feel. The mosaic wart are in clusters. What do you mean by clusters? The warts are either 2 or 3 in same place. There is cluster appearance. As you can see, there are 2 warts here and also you can see that the blood capillaries are very clearer in the mosaic wart. The mosaic wart, the blood capillaries, we can see pinpoint appearance. That is the characteristic feature of the mosaic wart. Then coming into the plantar warts. So what is the commonality in the plantar wart is that they appear on the soles of the feet and whenever you are walking, due to pressure, they become flat. They are like flat warts but they are not flat warts because they become flat due to pressure and also you can see that there is thickened skin in and around the area. You can see a clotted blood vessels and also they are very painful to touch. So whenever you are walking, you feel severity or the pain index or pain severity index growing. So there is severe pain while walking or plantar warts. The next kind of warts are genital warts which appear on the genital area. That is also because of having more than one sexual partners. This can spread from one person to another and these appear usually on the genital area. Now coming into the conventional treatment part of warts. What is conventional treatment? The Western medication or the usual allopathic prescription what we get or how they treat the wart. Primary thing is cryotherapy or freezing. As you can see in the picture, the liquid nitrogen is sprayed on the growth of the wart. If you can see, this is a wart. As you can see in the picture, if this is the wart, they spray liquid nitrogen at the base of the wart. So what happens when you freeze or when you pour liquid nitrogen to the base of the wart is that slowly the skin will start getting irritated and the base part of the wart is broken and it is sealed there. But what are the side effects of cryotherapy? You can remember that they're just taking away the symptom of a wart, but they are not taking away the cause of it, which is HPV infection, and also it can be thin epidermis layer, or it can also be the immune suppression or the low immune system. Salicylic acid. What is salicylic acid? Salicylic acid is a beta hydroxy acid or BHA. Continuous application of salicylic acid to the wart will cause irritation of that area and will exfoliate the wart completely. Even this method has its own risk factors. First thing, increased use of salicylic acid can cause skin irritation, it can cause redness, and also not only that, it will only treat the wart but it is not internally curing the disease. Electrosurgery. What is electrosurgery? Alteration of different electrical currents to treat the base of the wart or the wart. It is a type of surgery where they use electrical currents to remove the wart. The same thing. It has its own side effects where it can cause redness, it can cause irritation, and also it is not treating what is the proper cause of the disease. Laser therapy. Using of laser to treat or to cut off the wart. Immunotherapy. So what is immunotherapy? In immunotherapy, they trigger a certain immune response so that will fight back the HPV. But remember, the immune cascade or the immune reaction might not go as we want it to go. It can cause different reaction in different parts of the body. Now let's get into the homeopathic treatment part of wart. Why should you prefer homeopathy if you're suffering from warts, and why should you prefer homeopathy and not other systems of medicine? Because primary thing, as we can discuss, is that the conventional treatment or the allopathic treatment has its own side effects. Here in homeopathy, we do not have any side effects. It's very safe to use. Any person can use it. Either it is an infant, a child, a teenager, an adult, or a really elderly person can also use homeopathy. Second, it is not only safe, but it is also very easy to use because of the palatable homeopathic globules. Thirdly, it has no side effects. It's easy to use, and also it is holistic. That means it internally starts treating your disease. Primary thing, it helps in getting rid of the HPV infection, and also it helps in healing the body inside out by increasing the immune response. So when you have a good immune response, it will help in clearing off the HPV infection, and not only that, it will prevent in further recurrences. That means it will help so that your immune system is so strong that even if you have a cut in the epidermis in the future, you might not be affected by the HPV infection. It is timely, and also there is no painful treatment like cryotherapy happening in homeopathy treatment. There is low recurrency rate, and it is an individual treatment. That is, if you're having a flat wart, or if you're having a common wart, if you're having filiform wart, your representation is because you're an individual. By treating you with a specific tailor-made individual treatment, your immune system response is heightened, you have a better health, and not only that, overall your health is improved and your infection will slowly start disappearing and the recurrency rate will go down very low. So prefer homeopathy over top conventional treatment methods. What is the prognosis of this wart, or what happens if you neglect the wart? First thing what will happen is, around 65% of the cases of warts will resolve within 2.5 years or 2 years. But the spreadability, what about the spreadability? Even if this wart which is appearing in this hand is going down in 2 years, what if it has come in contact with the other hand or with the other person, or the towels that you have used for this hand are in contact with other person? It will spread. Not only that, if there is alarming signs, that is bleeding, itching, burning, increased spread or more warts, and you don't know if they are warts or not, then this can cause cancer. Less than 1% chance, but still if there are alarming signs, there is every chance for that wart to turn into cancer. That can be the primary stages of cancer. And not only that, after spreading, especially the buccal or the mucosal HPV strains which cause warts inside the mouth, can spread from one person to other person if they are having multiple sexual partners. They can also lead into genital warts. Let us discuss about the precautions as well. Make sure that you clean your hands and your feet as soon as you come from outside. And not only that, if you are having any cut, Try to treat it with an antibacterial solution and then seal it off with a bandage. And if you have low immune system, use medicines which will heighten or which will increase your immune response. Let us now talk about the consultation part here at Fidicus Homeopathy. As if you're suffering from warts and you want to cure your warts, or you have different kinds of warts and you don't know what kind of wart it is, or it is spreading rapidly and you want to cure for it, here at Fidicus we have two consultation options. First one is the online consultation, second one is the offline consultation. If you're staying nearby us, you can come and visit us in person. If you're staying far away from the nearest branch of Fidicus, you can visit us online. That is audio consultation and through video consultation. You can consult us and we will check your investigations and we will let you know if you want any more investigations. After doctor consultation, if you want medications, the medications will be delivered to you through home delivery directly to your doorstep. So if you're staying in India, it might take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days for the medicines to reach you. If you're staying anywhere else, it can take 4 to 8 business days for our medication to reach your doorstep. If you want to choose homeopathy, choose Fidicus Homeopathy. If you want to choose us and you would like to get in touch with us, you can contact with this number either through WhatsApp, through call, or you can ping us a message and our staff will get back to you. If you're suffering from warts and you want to cure it, then why should you choose Fidicus Homeopathy? First thing, Fidicus stands is for its highest chances of health, and we proudly follow three principles. First is our highest success rate. People who are already suffering from warts have come to our clinic and have got good results. Second thing is a transparent treatment. If you're having any sort of doubts, we will let you know about your prognosis. There will be no gray area between the patient and the doctor. The personal care here at Fidicus is top notch. Any sort of doubts, any sort of queries, all your myths will be busted after talking to the doctor. So if you want to choose homeopathy, choose it right. Choose Fidicus Homeopathy. Thank you.